Good morning and welcome to the San Francisco Interfaith Council online briefing for community and faith partners. In today's program, we hear about the story and fate of Laguna Honda with featured presenter, former San Francisco City Attorney and Supervisor, Louise Renne. The San Francisco Interfaith Council online briefings are supported by a grant from MediFund. Thank you. The important and ongoing work of the San Francisco Interfaith Council would not be possible without generous funding from congregations, corporations, faith-based social service agencies, foundations, judicatories, and supporters like you. Help us spread the word. Visit sfinterfaithcouncil.org to learn about SFIC programming and how to become a supporter. Follow SFIC on Facebook and Twitter, and subscribe to SFIC's YouTube channel to watch all of our previous virtual events. A bit of housekeeping. Today's program is being recorded. For audio and video, all participants are muted and without video to minimize distraction. To submit a question or comment, select the chat button at the bottom of your screen and send a message to Q&A. Questions will be forwarded to the presenter and answered time permitting. To activate closed captions, select the live transcript button at the bottom of your screen and click Enable Live Transcription. Now is the time to come together, San Francisco. Together we can stop Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality, as it is simply a disease. To report a hate crime, call the SFPD at 415-553-1133. And at this time, I'd like to hand the floor over to the Executive Director of the San Francisco Interfaith Council, Michael Pappas. Michael, the floor is yours.
Thank you, Trey. Good morning. I'm Michael Pappas, and on behalf of the San Francisco Interfaith Council, I want to welcome you to this week's online briefing for community and faith partners. Laguna Honda is a skilled nursing and rehabilitation center owned and operated by the San Francisco Department of Public Health. Located on a 62-acre campus in the heart of the city, Laguna Honda is one of the largest skilled nursing facilities in the United States and represents one of the most extensive commitments by any city or county to therapeutic care for seniors and adults with disabilities. It was founded in 1866 to care for one of the first generations of San Franciscans, the Gold Rush pioneers. A century and a half later, it remains a civic icon representing San Francisco's tradition of service to the underserved. Former San Francisco City Attorney and member of the Board of Supervisors, Louise Renne, a longtime champion of Laguna Honda, is this week's SFIC Online Briefing for Community and Faith Partners featured presenter. Her remarks will focus on Laguna Honda's history, mission, services, evolution, and current institutional as well as patient challenges as it faces federal centers for Medicare and Medicaid Services recertification. At this time, as we do with each of these briefings, I will read the interfaith statement, which is self-explanatory. This is an interfaith community. Whatever our individual belief, it can be freely expressed here with no apologies. If we are invited to offer prayer in this setting, it should be offered according to the tradition with which we identify. If we are invited to speak on a subject from the perspective of our tradition, we are free to do so without fear of offending those who come from another tradition. We come together as people of faith to learn from each other, that we might better understand the multiplicity of faith traditions in our city and in our world. At this time, it gives me great pleasure to welcome His Excellency Archbishop Salvatore Cordileone, Archbishop of San Francisco. When we first proposed this program, Louise was so taken with the Archbishop's advocacy and open statement on Laguna Honda that we could not invite the Archbishop to open us with this reflective moment. It's an honor to have you with us, Archbishop, and the floor is yours.
Thank you, Michael. As we begin, let us take just a moment of silence to make ourselves aware of the divine presence among us. In my own Catholic faith tradition, we like to celebrate the memory of our ancestors who have excelled in living out their faith. We call them saints, and each one has a special feast day. Yesterday was the feast day of St. John of God, a 16th century military career man turned priest on the Iberian Peninsula. He became a priest not to avoid the rigors of military life, or even to retreat to the confines of a parish to attend to comfortable pastoral duties, but to dedicate his life to caring for the needy and the sick, even founding a community of like-minded brothers to do so. They gave up everything, fame, fortune, and family, to give their lives completely to caring for the sick. In his letters, he wrote about how difficult it was to make ends meet, always being short on money. That's because they did not charge for their services. He even spoke about how at times he was hesitant to go out on the streets because of his great debts, for fear that he would be seized by his creditors. But upon seeing the poor and suffering sick, he could not do other than to care for them. He learned a lesson that repeats itself over and over. Trust in God and do the right thing, and God will provide. Other communities from my own faith tradition dedicated to caring for the sick and the elderly are present and active here in the Bay Area. The Little Sisters of the Poor arrived in San Francisco in March of 1901, recognizing then as now that, in addition to material poverty, many older people suffer from a lack of human and spiritual support. So the sisters provide care for the whole person, emotional, spiritual, and social life, as well as physical and medical needs. They continue in that same spirit of relying on God's providence, manifested through the generosity of good and generous people in the community. The Order of Malta operates a free medical clinic out of the Cathedral of Christ the Light in Oakland. They have been caring for the sick for 1,000 years and fondly refer to them as our lords. These lords are the ones who reveal God to us. God lies hidden within them, inviting us to enter in and discover divine love. It is the lesson of the Gospel of St. Matthew in chapter 25. I was sick and you visited me. Come inherit the kingdom prepared for you from the foundation of the world. That kingdom is not a spiritual place of light we will get to if we are willing to put up with the drudgery of this world. No, it is in our midst, ready to be discovered, if we are wise enough to look for it where it is hiding. This sensitivity to the special status of the sick and the elderly, of providing them holistic care, spiritual and emotional support, and a sense of community, in addition to medical care, is emblematic to the faith of any tradition, and it is lived out as such, as it is a profound expression of love of God through love of neighbor. We can thank many other faith communities here in San Francisco who care for the sick and elderly with this same vision. And it is this spiritual sensitivity that motivated the founding of Laguna Honda Hospital in 1866. We can think about that time of history here, a time of widespread disease and social chaos in the wake of the fortune seekers coming during the gold rush. And it continues to imbue its service today, where it is still a beacon of service to the underserved in San Francisco. Pope Francis, in his message for the World Day for Grandparents and the Elderly in 2022, said the following: many people are afraid of old age. They consider it a sort of disease with which any contact is best avoided. The scriptures see things differently. A long life, so the Bible teaches, is a blessing, and the elderly are not outcasts to be shunned, but living signs of the goodness of God, who bestows life in abundance. Blessed is the house where an older person lives. Blessed is the family that honors the elderly. For many elderly, family means something different from blood relatives. They either lack them or tragically are ignored by them. Laguna Honda is among those institutions that are not simply institutions, but family. Family for the sick, the elderly, and for people with a whole host of physical, mental, and social challenges. A place where care is provided in the context of community, human presence, and the human touch. Let us then trust in God and do the right thing, confident that if we do so, God will provide. Amen.
Amen. Thank you, Your Excellency, for grounding us with this reflective moment, and we ask for your continued prayers, both for Laguna Honda and for the residents that are there who continue in their own struggles. May this institution be a shining star for San Francisco. Thank you. We are very, very blessed to have with us today Louise Renne, whom I consider a colleague and a friend. She is a former city attorney for San Francisco and a former member of the Board of Supervisors. Currently, she is a founding partner of Renne Public Law Group. Over the years, in both her public and private capacities, she's been involved with Laguna Honda, its staff, and its residents. She and her firm are currently acting as counsel for the residents at Laguna Honda Hospital on their fight to forestall eviction and transfer. Louise, thank you for contacting me and sharing your interest to share this story, if you will, with the broader community. My own experience with Laguna Honda was first as a clergyman visiting residents and patients there. And secondly, sitting with our dear Rita Semmel when Laguna Honda reopened. And I just remember seeing this sparkling place that really offered dignity and love and services to those who were residents there. You have been a longtime champion, and thank God for that. You're a city shiro, if you will. And we are grateful to have you here today. In order to understand what's going on in the headlines today, we've invited you to talk about the story of Laguna Honda, to give us some context as well as the current struggles. So we thank you for being here. The floor is yours.
Thank you, Michael. Thank you for your kind remarks. And to the Archbishop, thank you so much for your remarks. I know some might ask, how did I become involved with Laguna Honda? And it really goes back to my days on the Board of Supervisors when then Dianne Feinstein was mayor. And as many of you recall, Dianne was always one interested in the health and welfare of the citizenry. And one day she called me and she said, Louise, have you ever been up to Laguna Honda? I'm going out there, why don't you ride along? And so I did, and I instantly became impressed with the care and the just service provided at Laguna Honda. And then later, when there was a threat that Laguna Honda might be closed because of earthquake considerations, and it had large wards at the time, our city attorney's office had won a big case against the tobacco companies, and we were able to get enough money to rebuild Laguna Honda. And I recall going to then Mayor Brown and saying, Mayor Brown, I think we've got the money to rebuild Laguna Honda. And his words were, go for it, Renne. And so we put a bond issue and on the ballot. And of course, the citizens of San Francisco overwhelmingly voted for a new Laguna Honda, which opened in 2010, as I might say, the first green hospital in the state of California. We have presented a PowerPoint presentation, so for those who haven't been in Laguna Honda can perhaps see and better understand some of the background and the present day services provided by the hospital. As has been remarked earlier, Laguna Honda was established back in the gold rush days when it was then known as an almshouse for the poor. And the people there grew their own vegetables and gardens. They did their own clothes. And then as it continued over the years, there were always, of course, volunteers. There were people of faith that visited the hospital. And so it's located just across the street, if you will, from the Forest Hill Muni Station. But over the years, as the PowerPoint presentation will show, and we can see, this is some of the residents at the dining hall, a front view of the older building. There were Christmas performances. That's another picture of the relief home and residents reading. There were also, there was a church area. The volunteers have always played a big part of the Laguna Honda history. At Christmas time, Bing Crosby years ago used to perform. And although COVID has had an impact over the years, there's always been some sort of a holiday party. And certainly every resident of Laguna Honda had received a present. Then as the Laguna Honda moved along, as you will see, is a new Laguna Honda, which opened in 2010. And Laguna Honda it is one of the largest skilled nursing centers in the country. In fact, one of the few publicly owned facilities, but it has many, many attributes. I will say as an aside too, that just as in the old days, Laguna Honda was an almshouse for the poor, it continues to represent the poor. The residents of Laguna Honda are people that have dementia, Alzheimer's, end-of-life needs. There are people who, because of accident or trauma, can't walk, can't talk, are paraplegic. We have others in these more modern times that may have some substance abuse combined with their skilled nursing needs, which make them more challenging, if you will. But nonetheless, Laguna Honda has always provided not only good care, but an array of services unmatched in any other facilities. As you will see, you can see it's with the side of the hospital, it's light and airy. And the architects who helped rebuild Laguna Honda, Anshin and Allen, were well aware of the medical studies that indicate where you have a light and airy facility, it tends to retard the progression of dementia, and people feel better in light and airy facilities. And so that's why there are garden areas all around. And there are art classes for people who have never held a paintbrush. There's garden outside, there's reading areas. One of my favorite places is the farm. We have a farm. You can see some more of the activities there, but we have a petting farm where residents are able to go out and pet the animals. And in some cases, we can bring the animals in for those who can't go outside. We have a swimming pool. Lots of therapeutic equipment. You can see the indoor garden. And of course, volunteers and members of the faith community are regular visitors. So with all of these, don't let me forget the hair salon. Very important. We have a hair salon, and that is a very important part of the facility. Okay, so with all of these array of services, you would wonder why is Laguna Honda facing the challenges that it is today? Well, it all goes back to about 1.5 years ago when 2 residents from Laguna Honda left the hospital and went to downtown San Francisco. And there they got some fentanyl, went back to the hospital, and the nurses immediately recognized the problem, administered Narcan, and then took care of the situation. What happened next was there were some follow-up inspections that were undertaken by the state health department as well as CMS. CMS is the federal agency, Center for Medicaid and Medicaid Services under the U.S. Department of Health and Federal Services. So I think that they came in and they did all sorts of inspections, and they immediately came upon the idea that Laguna Honda should be decertified. And what this means is that the hospital would lose the payments that are necessary to run Laguna Honda. And that's an amount equal to about $500,000 per day or about $15 million per month with 700 residents and the needed care. Although CMS said that it wouldn't immediately decertify the hospital, they would give them some months to get things in order. But what they also said was that all of the residents had to be transferred beginning in and by September 15th. Even though the hospital wasn't closed, the residents would have to leave, no matter their medical condition, Alzheimer, end of life, everybody had to go. Now, it should be made quite clear that there are few, if any, places that will take residents like those at Laguna Honda, much less in the number that are there, or were there, I should say, 700. This is because these are poor people. And most hospitals today are privately run, and you have to have some means. In addition, there are in San Francisco, for example, a total of 1,500 skilled nursing beds, of which 700 are at Laguna Honda. Where are people going to go? Obviously, they wouldn't be able to stay in San Francisco. Frankly, not even in the Bay Area are there enough, much less in the state of California, as a number of phone calls made clear. But nonetheless, despite the fact too, that the residents and their loved ones were quite traumatized, they were told that they had to leave. So, excuse me, there was another side effect, and that is that patients at San Francisco General, often for their rehabilitation care, have to go to Laguna Honda. But the draconian order issued by CMS was no new patients could come into Laguna Honda. So the upshot was that Laguna Honda started the discharge of patients with the following tragic results. 50 left. Some immediately became homeless. 12 died. And that could be expected, because the fact of the matter is there are medical studies that indicate that where you have somebody who is elderly or quite ill, when they are moved to a new facility, they die because of the trauma. And 12 did die. When that happened, CMS then said, well, there would be a pause. And so, excuse me while I they did take a pause, and they said that they would delay any further work until a later date. As it happened to about this time, a lawsuit was filed by the city, and we filed a lawsuit on behalf of the residents to delay any further departures. The lawsuit with the city was settled, and as a result, now the decertification goes, or I should say the certification goes, excuse me, until November. But the transfer order for the transfer of patients is only until May 19th. And on May 19th, it all, according to CMS and the State Department of Health, starts again. I repeat, where are people going to go? There's no place for them to go. Unfortunately, the city did settle the case, as I said. Our lawsuit on behalf of the residents, because of some former, frankly, bad law, has been dismissed. We filed an appeal, and so we're keeping a close eye on the situation. Now, you might ask, well, what were these violations that has caused this result? And the answer is, yes, there were violations, just as there are violations in every single nursing facility, because we're dealing with human beings. Let me give you an example. A caregiver can be in the kitchen getting ready a plate of food, hears a cry for help, or is distracted to go and help a patient, leaves the plate of food unattended instead of covering it up. That's a violation. Why? Because it can attract flies, and older people sleep with their mouths open. And so you got to keep flies away. There are other more serious violations where doctor went on vacation and some appropriate medicines weren't given. There's no denial that there were violations, but I have talked to any number of knowledgeable people in the field, and they have all said, Louise, we do not understand this, because the violations that happened at Laguna Honda pale in comparison to the kinds of things that we have seen at other skilled nursing facilities. And the other thing that doesn't make any sense either is that Laguna Honda's record on COVID has been exemplary. In fact, they've gotten an award because of keeping patients and residents safe. Now, the result has been there haven't been the volunteers, there haven't been the number of people able to visit, but the COVID rate was kept down, certainly in comparison to what's going on in other facilities where that same thing has occurred. So the answer is that we are where we are today. We're up against this May 19th for the patient's deadline. And the question is, what is there anything that can be done other than litigation, which may or may not get anywhere? Well, a couple of thoughts. First of all, I am very heartened by the Archbishop's remarks asking that all involved please get together for the sake of the residents. Recently, Javier Becerra, who is the Secretary of the Health and Human Services, was here in San Francisco and did tour Laguna Honda. And according to all reports, said that he thought it was a very good-looking facility. I'm not sure if he used those words exactly, but that was it. And he did indicate that he recognized that it was difficult to find places for the people like those who are at Laguna Honda. So maybe with the goodwill and the help of those who are able to speak up, we may get a change for the sake of the residents. Finally, I've been asked, well, if it does come down to the fact that on May 19th or thereabouts, the residents have to leave, is there anything that can be done? And the answer is that individual residents do have the right to have an administrative appeal. How you do that is quite complicated, I'll have to say. And whether or not somebody, obviously somebody with dementia or Alzheimer's or under the care of the public guardian is not in a position to really do that necessarily. But there is a right. There's a organization called California Advocates for Nursing Home Reform that does have a fact sheet available that outlines what has to be done in cases of administrative appeal. But I am so hoping that those who are in a position to do something to stop this tragedy will, for the sake of the people at Laguna Honda. In San Francisco, we have a tradition of taking care of the poor and those in need, certainly as exemplified by Laguna Honda. Other public jurisdictions do not do this, and how in the world they're unable to do it, I don't understand. But I do hope that if you have a chance and you haven't been to Laguna Honda, that you at least drive by to see what a fine facility it is. And for those of you who have been there, help spread the word, because as I say, 12 already died, in my opinion, unnecessarily, and we cannot have any more. And certainly we don't need any more put out on the streets when they don't need to be. So Michael, with that, I will conclude, and hopefully you may have some questions that I might be able to answer. Thank you.
Certainly. Thank you, Louise. This was very, very informative, and I'm sure of benefit to all those who are attending today. I'd like to drill down on a couple of the points that you made. Okay. To start out with, you said that Laguna Honda has always been a place for people who are poor, yes, and of limited means. Can you give us an idea of the numbers, if you will?
Well, of the 700 originally, I would say my understanding is at least 90% are in Medicaid, with the remainder on Medicare. And so, you know, that if you're on Medicaid, that means you are poor or have limited means. And what complicates it too, as I mentioned too, is that privately run facilities just simply won't take people on Medicaid. And in some cases, they won't even take people if all they have is Medicare. You have to have independent wealth, or at least you have to have a family that has a lot of money. And certainly there's no place that I know of that's going to take people who have a public guardian as somebody who is their responsible party, if you will. So when you're talking about Medicaid being the primary source of funding, you can see that this is a place for poor people and people of limited means.
Thank you. Could you explain just a little bit more about the array of services afforded by Laguna Honda?
Well, you know, it's just remarkable, Michael. And again, I know a number of us have visited skilled nursing facilities, certainly privately runs, but I don't know of any facility that has a petting farm where people can come out and pet the animals, or the gardens that Laguna Honda has, the extensive gardens that they have, a hair salon, a art classes, a library, a swimming pool. Some of the people in Laguna Honda can't walk, but they can slide into the water and float. And there are an array of other physical equipment. The volunteers of Laguna Honda have always played a critical role. And I would be remiss if I did not emphasize how important the availability of the spiritual community being to the residents of Laguna Honda. In fact, just a couple of weeks ago, when I was out at Laguna Honda, I was walking down the hall, and one of the priests who was there came up and we were chatting a little bit, and we looked over at the art classes that were going on. He said, "Louise, you see that guy over there? I'm kid you not, he never held a paintbrush in his hand before, and he does beautiful work." Now, I don't know of many other skilled facilities that have, you know, that kind of access to art classes. As I say, the spiritual faith community has been a constant source of support. And I would add as well, Michael, that at Laguna Honda, there is 24/7 medical care available. That is not the case in a number of skilled nursing facilities. In fact, a doctor will often visit only when needed. But at Laguna Honda, there is nursing staff, medical staff there 24/7.
Thank you. It's interesting because one of our respondents, attendees says, want to learn more about Laguna Honda, read God's Hotel.
Yes. Well,
So you mentioned that there were violations at Laguna Honda. Can you expand on them? Because I think that some of the folks that are listening would appreciate that, and so that we have a realistic picture of what's going on.
well, there's no question. I've read all, let me backtrack and say, a couple of years ago, there were serious violations at Laguna Honda. And in fact, there are a couple of staff people who acted inappropriately, to put it mildly. And as a matter of fact, when I found out about it, frankly, I called the district attorney to have them prosecuted. Now, that didn't happen. And similarly, CMS did virtually nothing. I think there was a fine and that was it. If that had been what the trigger was, I would be a little more understanding than reading the violations now. I mean, some, for example, were, in addition to the plate of food that I mentioned or the medicines, some people at Laguna Honda, they're not allowed to smoke, but they may sneak a cigarette in. Okay, that's a violation. Or if they have a lighter in their room and that's found, that's a violation. So there have been a number of violations, but I have asked a number of knowledgeable people, including some in the nursing profession, are the kind of violations that going on at Laguna Honda, are they sufficient for decertification and or the more draconian measure of requiring all the patients to leave? And to a person, they have said no. That, and in my view, if there were violations, all right, call Laguna Honda out. But why would you ever say all residents have to be gone, no matter their medical condition, end of life, dementia, Alzheimer's, paraplegics, can't walk, can't talk? Are you serious? Where are they going to go? So that is what I do not understand. And frankly, Michael, I have yet to talk to anybody who fully understands.
You mentioned that there have been some additional side effects to the decertification of Laguna Honda and the possible transfer of patients. Could you elaborate on that for a little bit?
Yes, well, I think I did mention that. Well, first of all, one side effect is the trauma faced by the loved ones and the families. I get calls regularly from family members worrying about their loved ones and what's going to happen. So that's one side effect. The other side effect that I think is a very serious one is the fact that in the past, residents from San Francisco General were transferred to Laguna Honda for rehabilitation care. Now, that could be short-term rehabilitation care, or it could be the longer rehabilitation care. But with the ruling those many months ago that no new patients can be allowed in, I'm told by some people who are knowledgeable on the subject that there's now a backlog, I should say, of those at San Francisco General who can't get the rehabilitation care that they need. But another, and this is really a very sad thing, when we rebuilt Laguna Honda Hospital, the old building, and this was written in the environmental impact report, was going to be rehabbed, if you will, for assisted living and or potentially for homeless. And a group had come in and was going to try to redo the rehabilitation. instead of letting that building go empty when we need, the services that that building could provide. That effort has now been stopped, just dead in its tracks because of all of this going on. So those are some of the side effects that have been happening here.
One of the attendees today, actually the first question we received is related to this. So if you'll allow me to
Yes. Mhm.
She says the flow from San Francisco General Hospital opened the door to a population that staff at Laguna Honda were not trained to handle. How can Laguna Honda continue unless San Francisco General Hospital transfers are handled differently? Your thoughts?
Well, I know that there has been some criticism of Laguna Honda because some of the younger patients have some substance abuse problems, that is this day and age. I think Laguna Honda is undoubtedly looking at that question about whether or not they need to be handled differently. But that's something that I think is certainly worth considering and should be considered. But I don't think that's a good reason for saying everybody has to be left out. That is my serious contention. I don't have any question that if there is room for improvement, there should be improvement. And I will say that the person now who is the interim director, Owen Pickens, is an excellent person. And I know he's really trying to do everything possible to make things work. So if there is an issue on that, I think we should, it should be discussed. But again, that seems to me to be not enough reason for saying everybody has to leave. Where are they going to go? Where are they going to go?
Thank you. You said that there's been litigation surrounding.
Michael, I'm sorry, I don't mean to interject. One thing, I mean, Laguna Honda does have, if somebody is totally disruptive, Laguna Honda can have them leave. So there's, I mean, if somebody's going to be totally disruptive or violent or something of that nature, obviously Laguna Honda can and should let them leave. But I don't think that's what we're talking about in this circumstance. It's certainly not a reason to have somebody leave whose medical condition doesn't warrant it. I'm sorry, I didn't mean to.
No, not at all. Not at all. No, that's very, very helpful. Earlier, you said that there'd been litigation surrounding CMS. If you could expand on that, and then one of our attendees has a sort of a follow-up question on that.
Okay. Yes. Well, on the when there was a lawsuit filed by the city, but that was set to question the decertification. The city had first filed an administrative appeal, and I don't need to tell you that administrative appeals take forever and a day. And the city did finally file a lawsuit, as did we, against the decertification. But the city then reached this settlement with CMS, whereby they would be given until November, but still leaving the transfer of May 19th. Our lawsuit was dismissed by the court. We were representing residents saying that the court didn't have jurisdiction, and so we're taking that up on appeal. We think the court was wrong, but we're taking that up on appeal.
I think you might have answered this person's question, because she asks, in light of the fact that your lawsuit was dismissed, how do you realistically propose to prevent 120 bed cuts, closures, and evictions? Well,
that's a twofold question. As I say, we are filing an appeal. It will be going up to the Ninth Circuit, and that appeal will be filed shortly. When the person mentioned the 120 beds, it could be referring to something else that is going on, which I haven't touched upon, but should. And that is that, among other things, CMS has proposed a new rule that all skilled nursing facilities cannot have more than 2 bedrooms to a bath. Now, when Laguna Honda was built, it was built into neighborhoods. There's different neighborhoods. And then there are different suites within the neighborhoods, if you will. And in some cases, there are 3 individual bedrooms to a bath. If CMS has this new rule and Laguna Honda has to get rid of the 3rd room, that will mean the release of 120 patients. Laguna Honda was just built in 2010. And so where are you going to put 120 patients? At the time when Laguna Honda was built, as I say, you could have 3 individual rooms to a bath. And I will tell you, I know other skilled nursing facilities where they may have 7 bedrooms to a bath. Is CMS seriously going to require all of those beds to be gone? So there is a provision in the rule that would make it so the rule does not apply retroactively, and certainly to something that isn't built in 2010. So I'm certainly hoping that that new rule that they are proposing will allow new facilities like Laguna Honda to continue as they are. That's another complicating thing that's going on.
No, thank you. And I think that answers that question. One of our attendees asked the question, would you please speak to how developers have been coveting the land Laguna Honda property sits on, and how have developers impacted the situation?
Well, that's a question I often get asked. Isn't this really a subterfuge by developers to get the land? I mean, Laguna Honda sits on 62 acres of beautiful land, lovely neighborhoods. As I say, it's across the street from Forest Hill Station. And I have no doubt that developers would covet the land. But if there is a developer motivation in all of this, I am not aware of it. And if anybody has knowledge that this is actually what's going on, I would love to know about it, because right now it's a mystery.
Thank you. I know you've got broad shoulders, but you can't do it alone. Has the mayor or the board of supervisors weighed in on this at all?
Yes, they have. The mayor has weighed in on it. The board of supervisors has held several hearings and been quite outspoken about how wrong this is. When Nancy Pelosi's office has weighed in on this, that Senator Feinstein's office has weighed in on this. That's why nobody can understand what is going on. What is going on? I will tell you, Michael, I have heard something from some people in a position to know, which I haven't really said in public before, but I will now. And that is, there are some people who say that some of the bureaucrats in CMS had their feelings hurt and felt disrespected by something, I know not what, at Laguna Honda. If that's the case, that's terrible. That's terrible. But there is no rational explanation. Were there violations? Yes. Are they correctable? Yes. Can they be correctable without putting residents and their families under a traumatic cloud of having to leave? Yes.
Thank you. Just a question from another attendee. If Medicare and Medicaid payments are ending, how will the hospital stay funded?
That's the problem. Can the city pick up that amount of money? I think it'd be extremely difficult, if not impossible, for the city to pick up all of that money. As I mentioned earlier, I mean, we're talking about a significant amount of money, millions of dollars a month. And would the city pick it up? That would be a question for the mayor and the board of supervisors, but I think it would be extremely difficult. That's why the funding is crucial. As we all know, taking care of people in a hospital costs money. People individually can't do it, That's why we have Medicare and Medicaid. At least we haven't always had Medicare, but that is why we do today for most people. Can the city pick up all of that expense? If they could, that would be one thing. But the fact of the matter is that the reason we're having this dispute, if you will, is because it is very difficult for the city to pick up all that money.
The particular role you've been playing has been on behalf of the residents.
Yes.
If a transfer plan is enacted by May 19th, is there anything the residents or loved ones can do?
Well, as I mentioned, one thing they can do is they can ask for individually ask for an administrative appeal. Now, obviously, that is very, very difficult. If somebody has a loved one that's knowledgeable, then they can file an administrative appeal. And as I mentioned, the California Advocates for Nursing Reform have a fact sheet that outlines how you can go about filing that administrative appeal. And it's CANHR are the initials for Canner. And they have a form, if you will, that outlines what you need to do. But it's not exactly an easy process. And certainly for those who have Alzheimer's or dementia or don't have a knowledgeable loved one to help them, it's going to be difficult, if not impossible. So it's a remedy, but I'm not sure how realistic a remedy it is. That's the problem.
Thank you. You mentioned the Archbishop's call for parties to get together and the fact that Secretary Becerra recently visited Laguna Honda. Does that make you hopeful?
Well, I do try to remain hopeful. Yes, I am. The mayor and the members of the Board of Supervisors were quite outspoken, according to all reports, quite outspoken with Secretary Becerra when he was here. And I know one supervisor refused to go to the dinner that he was an honoree, if you will, and made it quite clear why she wasn't. So I'm hopeful that will make a difference. I'm hopeful too, frankly, that when people like the Archbishop and other people in the faith community who don't have a stake in the game, if you will make their views known, that will have an impact as well. Some people in the city have signed a petition that's been circulating to, in effect, save Laguna Honda. So maybe with all, if petitions have that, if people of faith will communicate to people in the public field, I hope it'll make a difference. Frankly, I wish I had a direct pipeline to President Biden, because I would think if the president knew what was going on, that he would do something about this. I just have absolutely no doubt about that, given what his stated interests are. I mean, the fact of the matter, Michael, as we all know, is that frankly, the way older people in the United States are taken care of today seriously needs to be revamped. I mean, ARP recently had an interesting article about some of the skilled nursing facilities, privately run, if you will, where you have difficulties finding the numbers of caregivers that you need today, the inadequate pay that caregivers get, et cetera, all of which impact the health care of seniors. And so President Biden has indicated an interest in this. I hope it progresses so that seniors everywhere, and not just those at Laguna Honda, receive better care than they're receiving today. across the United States, actually.
And-
Unless you're rich. If you're rich, you're okay. If you're wealthy, you're okay. If
and
you're
you're-
not so good.
I think your response to this question too is we've had a lot of people among the attendees asking, how can an individual or group have an impact on the situation? What's the recourse? I don't know if there's anything else you'd like to add to that.
Well, I think, I don't know what, I think petitions filed with Secretary Becerra, letters filed to Secretary Becerra, maybe letting the mayor, Congressman Pelosi, members of the Board of Supervisors know you care. I know they care, but maybe they in turn can go to, Secretary Becerra or Governor Newsom. The State Department of Health is involved in this. Where is Governor Newsom on all of this? I think their offices should be inundated with citizens saying, save Laguna Honda, save Laguna Honda. And if citizens speak out, and there are enough citizens speak out, if people in faith community speak out to the governor, the president, Secretary Becerra, but let our local officials know too that, hey, the citizens support you in trying to save Laguna Honda. All of us together hopefully will make a difference. We cannot do this alone. No one person can do it. It takes all of us working together. And if there are problems at Laguna Honda, let's get them straightened out, but let's not let the poor among us and those who need the skilled nursing care with this sword over their head, which it is.
Thank you. We've spent a lot of time today talking about the residents and their families. I just remember when we started this series, and this is like the 95th in a series. This series started because of COVID, and we spent a lot of time at the very beginning of this series talking about the frontline workers. This is going to have a pretty dramatic impact on the staff at Laguna Honda. I don't know if you want to speak to that, because I know that you have firsthand knowledge of the.
Well, Michael, I appreciate that question. I maybe don't say it enough, but really, I think the caregivers at Laguna Honda truly are doing the Lord's work. I mean, being a caregiver is not easy. And I remember pre-COVID, when there used to be lunches, if you will, honoring those who worked at Laguna Honda. And what was amazing was the longevity of their service. I mean, people at Laguna Honda make careers out of serving at Laguna Honda. And, they need to be respected. If you close Laguna Honda, I don't know what's going to happen to all of the caregivers, what happens to the nurses, what happens to the physicians. And it's just wrong. And I have an enormous amount of respect for those that work at Laguna Honda, because, it's not easy being a caregiver. There's no question about it, but they do it well. And if they don't do it well, then they don't stay at Laguna Honda. But people stay at Laguna Honda because they know that what they are doing is helping those in need.
Thank you. And to respond to, a final question we have here, are there drafts of what citizens should say in these calls to legislators? What we can do is, if you can provide us with that, when we send out the recording link to this, we can include that as a resource.
I think the easiest thing to do would be make it very short and simple. Save Laguna Honda. Do not evict the residents, the poor and the needy. That simple. Save Laguna Honda. Don't let the residents be evicted.
Thank you. We've come to the end of our hour. Is there anything else that you think that we haven't mentioned and that needs to be said?
Well, First of all, Michael and the Archbishop, thank you for your time and attention to this issue. And to those that are listening, I think that Laguna Honda has a tradition of which all in San Francisco can be most proud. If we were to have a trial, I can tell you there are family members who would speak on behalf of Laguna Honda and the good care that their loved ones have had at Laguna Honda. And good care is because of the workers and the physicians and the staff that are there. So my mantra is save Laguna Honda. Do not let the residents there be evicted.
It is we who thank you, Louise, for your advocacy, for your passion, for championing this cause. We look forward to sharing this recording link with our 5,600 e-subscribers so that this message can have a broader reach. We want to thank all of those who were online today and spent this time with us. And we invite you all to join us next Thursday at this same time, 8:30, when we welcome members of the California Reparations Task Force who will present on their findings and their recommendations. This brings to a close today's program and briefing. God bless you all and God keep you.